Imagine this for a moment. You're home alone, maybe watching TV, maybe getting ready for bed, and suddenly, your chest tightens. Your left arm starts to feel heavy. Your breathing becomes shallow. Your heart is in serious trouble, and there's no one around to help you. This exact situation happens to hundreds of thousands of seniors every year. In fact, emergency records show that more than 380,000 people in the U.S. suffer heart attacks while completely alone. But here's what most people don't realize. A large study published in the European Heart Journal found that people who knew what to do in the first 60 seconds of a heart attack increased their survival by over 70%. Not because of expensive equipment, not because of fast ambulances, but because they took the right actions immediately before panic took over. And yet, surveys show that nearly 9 out of 10 adults over 60 have no idea what to do if this happens while they are alone. They freeze, they lie down, they wait, and some of the things they do actually reduce their chances of survival. So today, I'm going to walk you through 7 science-based actions that can keep you alive long enough for help to arrive, even if you're completely by yourself. These are not internet tricks. These are strategies supported by emergency medicine and cardiology research from institutions like Johns Hopkins, Mayo Clinic, and Harvard Medical School. And the number one tip on this list is so powerful that emergency dispatchers are now trained to coach people through it over the phone, because it can buy you the same survival advantage as having a paramedic right next to you. Before we start, tell me in the comments, how old are you and where are you watching from? We actually read and replied to your comments, and your story could help someone else prepare. Now let's begin with a step that saves lives before the heart attack even happens. Tip number 7, build your emergency communication system. This might sound simple, but when your heart is failing, simple becomes impossible. During a heart attack, your brain starts losing oxygen almost immediately. Within 20-30 seconds, many people become confused, disoriented, or unable to think clearly. A study in the Journal of Emergency Medicine found that over 60% of heart attack patients could not even say their own address when calling 911. Not because of dementia, but because oxygen deprivation shuts down clear thinking fast. So here's what you must prepare right now, not during the emergency. Step 1. Post your address by every phone. Write your full address, apartment number, and gate codes on a bright card. Tape it next to every phone in your home. When panic hits, you won't trust your memory, your eyes will. Step 2. Program emergency speed dial. Yes, you can dial 911 normally, but when your hands are shaking and coordination drops, one-button dialing saves precious seconds. Program emergency as speed dial number 1 on your cell phone, any landline, even cordless kitchen phones. Step 3. Keep your phone. Within arm's reach at night, heart attacks in seniors happen most often between 10 p.m. and 6 a.m., and many phones are charging in another room. Keep your phone on your nightstand fully charged with ringer volume high. Step 4. Wear medical alert devices. Even in the shower studies from the National Institute on Aging found that nearly 1/3 of people who own alert devices weren't wearing them during their emergency. Why? Because they removed them to bathe or sleep. If you use one, make sure it's waterproof. Comfortable enough to wear 24/7. Step 5. Inform trusted neighbors or building staff. If you live alone, give a neighbor a spare key. Tell building managers or doormen about your condition. Paramedics losing access time costs lives. This system doesn't treat the heart attack, but it ensures help can reach you as fast as possible. And now let's move to something that can buy you extra time before you lose consciousness. Tip number 6, cough CPR, when and how it actually helps. You may have heard of cough CPR. Some people think it's a myth. Others think it works for everything. The truth is more specific and more useful. Cough CPR can help only in the early moments of dangerous heart rhythm disturbances, when you are still conscious and able to control your breathing. A clinical study from China followed patients who were trained in this technique and found they remained conscious up to 90 seconds longer on average when heart rhythm became unstable. That extra minute can be the difference between making the emergency call or collapsing before help is on the way. Important rule. This does not replace calling 911, and it does not fix blocked arteries. It only helps maintain blood flow temporarily while waiting for emergency response. How to perform cough CPR correctly. At the very first sign of serious heart symptoms, take the deepest breath you can. Fill your lungs completely. Cough forcefully from your chest, not a throat cough. Push hard using your diaphragm. Repeat every 2 seconds. Deep breath, strong cough. Deep breath, strong cough. Keep going until help arrives, or you're instructed otherwise by emergency services. What's happening inside your body? Deep breaths increase oxygen. Strong coughs squeeze the heart. That pressure helps keep blood moving to your brain. Oh, it's not a cure, yes, but it can prevent sudden collapse in certain rhythm problems. Again, this only works while you are conscious. You can breathe on your own symptoms just started. Once consciousness drops, this method no longer helps. And that brings us to a step almost everyone knows about, but most people do incorrectly. Tip number 5, the aspirin method that works faster. Almost everyone has heard this advice. Take an aspirin if you think you're having a heart attack. And that advice is correct, but most people take it in a way that makes it work much slower than it should. Here's why this matters. In most heart attacks, a blood clot is blocking one of the arteries that feeds your heart muscle. Aspirin doesn't dissolve the clot, but it prevents it from growing bigger and helps blood squeeze past the blockage. A massive study in The Lancet showed that taking aspirin in the first hour of symptoms reduced death rates by more than 20%. But here's what almost no one tells you. Chew it. Don't swallow it. When you swallow aspirin whole, it has to reach your stomach, dissolve, pass through your intestines, then finally enter your bloodstream. That takes far too long during a heart attack. Researchers at the University of California found that chewed aspirin reached effective blood levels nearly twice as fast as swallowed tablets. Those extra minutes can mean less heart muscle damage, better recovery, higher survival, correct emergency dose, 325 milligram total. That's 1 regular aspirin or 4 baby aspirins, 81 milliliter each. Chew it completely, even if it tastes awful. Let it absorb through the lining of your mouth if you already take daily aspirin. Still take the emergency dose. Your daily preventive dose is usually not enough during an active heart attack, when not to take aspirin. If you are allergic to aspirin, if your doctor has specifically told you not to take it, if you are on strong blood thinners and were warned against emergency aspirin use, if unsure, still call emergency services immediately and follow their instructions. Store aspirin in multiple locations. Keep non-coated aspirin in your bedroom, kitchen living room, car purse, or wallet. Check expiration dates every 6 months. Heat and moisture reduce effectiveness. Now, aspirin helps with the blood, but your body position can help with oxygen and heart workload. And that brings us to tip number 4. Tip number 4, the cardiac relief position. When chest pain hits, many people instinctively lie flat. That feels natural, but in many cases, it actually makes things worse. Lying flat can increase pressure on your heart, make breathing harder, allow fluid to build in your lungs. European emergency guidelines show that proper positioning can maintain oxygen levels up to 40% longer during cardiac distress. The correct position. Sit upright at about a 45-degree angle. You can lean against a wall. Sit on your bed with pillows behind your back. Sit on the couch, slightly reclined. Your knees should be bent. Feet supported. This position reduces strain on the heart, improves lung expansion, helps blood circulate more effectively. If you feel like you're about to faint, slowly lower yourself to the floor. Do not just collapse. Once down, lie on your side, not your back. Bend the top knee slightly for stability. This is called the recovery position, and it keeps your airway open, prevents choking if you vomit, protects your spine if consciousness drops. Loosen tight clothing, immediately loosen. Belts, collars, bras, tight waistbands, even small restrictions reduce breathing efficiency. Studies in cardiac nursing journals found that loosening clothing can raise oxygen saturation several percentage points, which matters when your heart is struggling. Keep the room cool, not cold. If you're sweating, do not wrap yourself in blankets. Open a window slightly if possible. Overheating increases heart workload. Now we've helped. Blood clotting, aspirin, oxygen flow, body position. But panic itself can make heart attacks worse. which leads to the next step that protects your heart muscle directly. Tip number 3, the controlled breathing that protects your heart. When people feel chest pain, they almost always start hyperventilating. Fast, shallow breathing does 3 dangerous things: lowers oxygen delivery to the heart, raises heart rate, tightens blood vessels. Stanford cardiology researchers found that patients who controlled their breathing during heart attacks had significantly less heart muscle damage. The breathing pattern that works. This is called paced diaphragmatic breathing. Here's how to do it. Inhale through your nose for 4 seconds. Feel your belly rise, not your chest. Hold for 4 seconds. Exhale slowly through pursed lips for 6 seconds like you're blowing out candles slowly. Repeat continuously. The long exhale is critical. It activates the calming branch of your nervous system and reduces oxygen demand on your heart. How to know you're doing it. Right place, one hand on your chest, one hand on your belly. Your belly should move more than your chest. Count out loud if you can. This helps you. Keep rhythm. Stay conscious. Let emergency dispatchers hear that you're responsive. Patients who practice this breathing technique before emergencies were far more likely to use it successfully under stress, which is why learning it now matters. And now we reach a step that almost no one thinks about, but it may save you if help can't reach you fast enough. Tip number 2, the emergency door and signal protocol. This may sound simple, but it addresses one of the most common and deadly problems during home cardiac emergencies. Paramedics arrive, but can't reach the patient in time. A large study in the Journal of Emergency Medical Services found that locked doors delayed treatment by an average of 10-12 minutes. And in heart attacks, those minutes are often the difference between life and death. First action: unlock your door. Immediately. At the very first sign of symptoms, even before sitting down, do this. Walk to your front door. Unlock it. If possible, leave it slightly open. Why this matters: during major cardiac events, many people lose the ability to walk within 3-5 minutes. Once you're on the floor, you may not be able to reach the door at all. University of Pennsylvania researchers found that patients who unlock their door as their first action had nearly 50% higher survival rates than those who waited. If you live in an apartment or building, do this in this order. Call emergency services, then immediately call front desk security building manager. This allows responders to bypass locked entrances, reach your unit faster. Urban emergency studies show this reduces response time by 5 to 7 minutes in multi-story buildings. Make your home easy to find. While waiting for help, turn on all lights in your home. At night, turn on porch or balcony lights. During daytime, hang something bright in your window or door. Paramedics report that visible homes are found minutes faster, especially in large complexes. Use noise if you can't speak. Keep a whistle on your keychain, one in your nightstand. If your voice is weak, loud noise helps responders locate you faster inside the home. Emergency information sheet. Tape a paper inside your front door at eye level with your full name, medications, allergies, heart conditions. Emergency physicians report that visible medical info reduces treatment delays by over 25%. Lockboxes and smart locks, if possible. If you can, install a key lockbox outside your home. Register the code with your local fire department, or use smart locks that can be opened remotely or auto-unlock when emergency calls are placed. Homes with registered access systems have significantly faster treatment times. Now that we've handled medication position, breathing, emergency access, we come to the single most powerful action you can take if you have been prescribed it. This final step has been shown to give nearly the same survival advantage as having a paramedic already in the room. Tip number 1, the immediate nitroglycerin protocol. This is the step that stunned researchers. Harvard Medical School studies showed that patients who used nitroglycerin correctly within the first 3 minutes of symptoms had survival rates comparable to those who received immediate professional treatment. But here's the problem. Most people who carry nitroglycerin don't use it properly when they actually need it. What nitroglycerin does it works by? Relaxing blood vessels, reducing heart workload, improving blood flow through narrowed arteries. If the blockage is partial, nitroglycerin can significantly reduce heart muscle damage, and sometimes even stop worsening of the attack. Large-scale studies show early nitroglycerin use can reduce death risk by over 30%, cut heart muscle damage nearly in half. The exact correct method. At the very first warning signs, sit down immediately. Never take nitroglycerin standing. It can drop blood pressure fast and cause fainting. Place one tablet under your tongue. Not on top. Do not swallow. Let it dissolve completely. Takes about 20-30 seconds. A mild tingling or warmth is normal. That means it's working. Wait 5 minutes. If pain or symptoms are not improving, take a second tablet. Wait another 5 minutes. If needed, take a third tablet. Never exceed 3 tablets within 15 minutes. Store it correctly or it won't work. Nitroglycerin is extremely sensitive to heat, light, air, moisture. Always keep it in the original amber glass bottle, tightly closed away from bathrooms and cars. Replace it every 6 months, even if unused. When opening a new bottle, write the date on the label. If a tablet causes no sensation at all, it may no longer be effective. Critical safety warning. Never combine nitroglycerin with erectile dysfunction medications, Viagra, Cialis, Levitra. This combination can cause dangerous, sometimes fatal, drops in blood pressure. Always tell emergency responders what medications you've taken. Combine with aspirin. When appropriate emergency medicine studies show that chewed aspirin plus nitroglycerin together provide far better outcomes than either alone. They address clot growth vessel, narrowing simultaneously. Final reminder. These steps are not meant to replace medical care. They are meant to keep you alive and reduce damage during the critical minutes before help arrives. Practice matters. Practice breathing techniques. Know where your aspirin is. Check your nitroglycerin dates. Make sure your door access plan is ready because when fear hits, muscle memory saves lives. If you remember nothing else from this video, remember this. Most heart attack deaths at home don't happen because help was impossible. They happen because the right steps weren't taken soon enough. Not because people didn't care about their health, not because they ignored doctors, but because no one ever taught them what to do when they were alone. And that's what makes this so heartbreaking. I've treated patients who survived but lost their ability to walk, lost their speech, lost their independence, and almost every time they say the same thing. I thought I just needed to lie down and wait. I didn't want to bother anyone. I thought it would pass. But heart attacks don't wait, and minutes decide futures. Why preparation matters more than fitness. You can eat well. You can walk every day. You can take all your medications. And still, heart attacks can happen. What determines whether you recover or suffer permanent damage is not only what you did for years, but what you do in the first few minutes. That is when blood flow can still be restored. Brain damage can still be limited. Heart muscle can still be saved. Those minutes belong to you, not to the ambulance. This is not about fear. It's about control. This video is not meant to scare you. It's meant to give you back control. Because when your body feels out of control, your mind knowing what to do becomes your strongest weapon. You don't need medical training. You don't need equipment. You just need knowledge and preparation, and that can change everything. Not tomorrow, not next week, today. Check where your phone is at night. Put emergency info by your door. Make sure aspirin is accessible. Check nitroglycerin dates if you have it. Tell someone you trust about your emergency plan. And most importantly, share this video with at least one person you care about, because the person who needs this most might not be the one watching right now. I want to ask you something important. Do you live alone? Or do you spend long hours alone during the day? And what worries you most about heart health right now? Leave a comment below. We read them. We reply, and your story may help someone else realize they are not alone. Tomorrow's video will cover early warning signs of heart trouble that doctors often miss in seniors, and especially symptoms that look like normal aging. Many people ignore them for months until it's too late. Make sure you're subscribed and turn on notifications so you don't miss it. Because staying informed is one of the strongest forms of protection you have. You've worked hard your entire life. You deserve to enjoy your years with strength, clarity, and independence. A heart attack does not have to steal that from you, but preparation can protect it. Take care of yourself, and I'll see you in the next video.